One of the most common questions patients ask is what makes ASTR different from other traditional medical approaches? In order to answer this question, we first have to look at what is currently being done in the medical field to treat pain. Most of the techniques being used in today's modern world have their roots in ancient healing practices. Manipulation, massage, stretching, and exercises were all used by the Romans, Greeks, and Egyptians to increase flexibility, strengthen muscles, and relieve pain. Modern medicine has incorporated cold, heat, electric stimulation, and joint adjustment to the list. But overwhelming research evidence, including a recent study done by University of Ottawa, Canada, found that the benefit of massage, acupuncture, and spine adjustment treatments was mostly evident immediately or shortly after the end of the treatment, and then faded with time. The reason why no long-term benefits are found with these techniques is because they aren't addressing the source of the problem that nearly all patients experience, and that is scar tissue. Now, I'm sure you've heard of scar tissue before, but do you really know what it is or how it develops? If not, let me take you on a little journey through the body's natural injury and healing cycle so you can understand why scar tissue develops and how ASTR uniquely treats this issue while providing long-term pain relief. So stage number 1, the body gets injured. Now, this can be from accidents, surgery, disease, poor posture, or even poor body mechanics. Once the body is injured, stage number 2 occurs, which is inflammation of the injured area. This inflammation causes damage to the body's healthy tissue, and as a result, the body creates scar tissue. Stage number 3. Once scar tissue develops in the injured area, that same body part and surrounding muscles and joints will experience a cascade of events, including muscle spasms, fascia restriction, and trigger points, causing high levels of pain, decreased range of motion, and if left untreated, could result in nerve damage, chronic pain, or possible surgery. Stage number 4. Without intervention, the body may eventually break down the excessive scar tissue over a period of a few months or even years, hopefully leading the body to the end of the healing cycle. Now, this is the ideal scenario, but it's one that we rarely see. Most people need immediate scar tissue intervention in order to complete the healing process and experience long-term pain relief. But we have 2 problems. Number 1, most medical providers are not aware of the importance of breaking down scar tissue as it relates to the body's natural healing process. The second problem is that the few scar tissue techniques that currently exist in the market are invasive and extremely painful, and can even cause new scar tissue to develop as a result. So are you frustrated yet? Well, we were too, which is why we developed advanced soft tissue release. ASTR is a new specialty that is revolutionizing the way patients experience long-term pain relief. ASTR's licensed doctors use patented state-of-the-art tools and over 125 maneuvers to quickly and gently relieve pain. ASTR helps patients who are stuck in the scar tissue stage transition to the healing stage by releasing scar tissue, fascia restriction, muscle spasms, and trigger points. In a recent retrospective cohort next study, completed on patients who received ASTR treatments, 83% of the participants experienced significant pain relief after their first ASTR treatment, and 87% of the patients who responded to the follow-up were still living pain-free 1 to 2 years after being discharged from treatment. What this data tells us is that ASTR not only provides immediate pain relief to its patients, but the results are also long-term. So tell me, are you ready to start your journey towards pain relief today? If so, give us a call, 949-236-6862. ASTR, a new approach to pain relief.